Mr. J, I'm Morgan.
And I'm Jenna.
And this is our lumbar eval. So first we're going to start with a little bit of history. So I'm going to ask my patient, where does it hurt?
It hurts my lower back.
And I'm going to ask her, can you describe the type of pain that you're experiencing?
It feels achy and then sometimes it feels a little tingly.
And then the follow-up question is there any tingling, burning, what you just said?
Tingling down my leg sometimes.
Okay. And then do you have any bladder control problems? And is there any sleeping position that makes it worse or relieves it?
It hurts worse when I sleep on my stomach. The next thing we're going to do is some bony palpation. So I'm going to start with the spinous process. So this one you can actually feel. It's going to be down the length of her spine. And it's the bone that pokes out when you round your back. When you round your back, you can feel it poking out just like so. And then the rest you can't really feel because of the muscles that cover your back. So I'm going to demonstrate it on the model here. So next is the transverse process, and that's going to be these bony attachments that poke out the sides right here. And then finally we're going to do the coccyx. So it's going to be about halfway down her butt, and it's at the end of her sacrum. So on the model here you can see it's right there.
Okay, so now we're going to move on to range of motion testing. So the first one we're going to do is extension. So I'm going to have my patient standing like so. We're going to ask her to put her hands on her hips and then lean back. Good. And I can stand behind her just to stabilize her in case she gets a little wobbly. And you can eyeball this, and usually it's 20 to 15 degrees, which she clearly got. And then next we're going to do rotations. So we're going to have my patient sit up here at the end of the table. We're going to start her across her ankles and put your hands across the chest. And then just rotate to each side. Good. Other side. Good. And again, for these, just eyeballing it for rotation, it's about 3 to 15 degrees, which she got.
Okay, so the next thing we're going to do is some soft tissue palpation. So I'm going to start with the interspinous ligaments. So where they would be located is down the length of her spine. And it's going to go across her spinous processes. So you can palpate it all the way down like so, all the way down her spine. And then the next thing we're going to do is her gluteus muscles. So we're going to start with the glute max, which is this right here. And then the glute med is going to be right here down to her greater trochanter, and then the glute minimus is also going to be located right about here.
Okay, so next we're going to palpate the sciatic nerve. The sciatic nerve runs from L4 down to S3 and goes through the piriformis muscle and down to the back of the leg behind the knee. So to palpate this, I'm going to find my patient's ischial tuberosity, which is about right there, and then her greater trochanter, which is about there. And then I'm going to take my thumbs and go halfway between both and give a nice little push. And she reported some discomfort, so I'm right on it. Right there.
The next thing we're going to do is some muscle testing. So I'm going to start with the rectus abdominis, which runs down the center of the thorax, down her abdomen. So what I'm going to do is I'm going to have her cross her arms for me. Good. And then ideally we have a band attached to the table or another person to help pull down her legs to eliminate any other use of her other muscles. But what I'm going to have her do is I'm going to have her sit up for me. Good. Go ahead, go back down. Then I'm going to add a little bit of resistance. Same thing, go ahead. Good. And then I'm going to have her go halfway. And I'm going to push down on her and have her resist my push. Ready? Go. 1, 2, 3, 4, 5. Good. Okay, and the next thing we're going to test is her iliopsoas muscles. So I'm going to have her bring her leg up like so, and then scoops a little bit off the table for me. Good, so her leg is hanging down in pre-stretch. I'm going to stabilize with my hip like so, and then my other hand's going to be resting on her ASIS to stabilize as well. So I'm going to have her bring her leg up to the sky. Good. Again, in pre-stretch, I'm going to add a little bit of resistance. Same thing, go up. Good. About halfway, like so. And I'm gonna add resistance. I'm gonna push down and have her resist my push. Ready? Go. 2, 3, 4, 5. Good. All right. The last thing I'm gonna test is her adductors. So I'm gonna have her cross her leg over on her side. Good. And then I'm going to stabilize on her hip right here. I'm gonna have her bring her leg up to the sky for me. Good. And I'm gonna add a little bit of resistance. Same thing. Go ahead. Up. go. 1, 2, 3, 4, 5.
Good. I'm gonna muscle test the glute medius. So I'm gonna have my patient on her side like so. I'm gonna have her holding under the edge of the table. And I'm gonna brace myself against her hip for stability. So I'm gonna have her top leg hanging off the end of the table like so, and her knee a little bit slightly bent. I'm gonna put her in a pre-stretch position, and I'm gonna ask her to bring your leg up to the sky. Okay. Good. Now I'm gonna do the same thing with a little bit of resistance. Go ahead. Good. Now I'm gonna bring my patient halfway and tell her, don't let me push your leg down. Ready? Go. 1, 2, 3, 4, 5. Okay. Now we're gonna muscle test the glute minimus. So I'm gonna have her come to the end of the table like so. And the glute minimus does internal rotation. So I'm gonna put her in a little bit of pre-stretch and have her go ahead and bring your foot in. Now we do the same thing with a little bit of resistance. Go ahead. Good. Now I'm gonna bring her about halfway and tell her, don't let me push your leg out. Ready? Go. 1, 2, 3, 4, 5. Okay, so we're gonna text the external rotators, which is very similar. So we're gonna have my patient in the same position. We're gonna actually have her go the other way. So I'm gonna put her in pre-stretch this way. And go ahead and bring your leg out. Good. We're gonna do the same thing, a little bit of resistance. Go ahead. Good. I'm gonna put her about halfway and resist my push. Ready? Go. 1, 2, 3, 4, 5.
So the next thing we're going to test for are some deep tendon reflexes, and I'm going to start with her Achilles. So the Achilles is innervated by the S1. So what I'm going to do here is I'm going to have her laying on her stomach like so. I'm going to have her fully relax for me, good. And then I'm going to have my hand right here just to feel if there's any pulse from her foot. And I'm going to find her Achilles tendon, which is right about so. And I'm just going to hit right there. And what I'm looking for here is just her foot to just slightly push out, and that means that her Achilles is still functioning, her S1 is still functioning.
Now we're going to do dermatome testing, and dermatomes are in relation to the nerve roots, and it's going to indicate like nerve impairment or impingement, and can just test the overall function of the nerve. So for all of these tests, I'm going to have my patient's eyes closed. I'm going to ask them to close their eyes, and I'm going to ask them to report which leg they feel it on. So first we're going to start with L2. So L2 will go from the front of the thighs to the knees, like so. And again, I'm going to ask her if she feels it, which she did. And then the next one is L4. So L4 is going to go from the outer thigh to the dorsal of the foot and the big toe. And then next one we're going to do S3. And S3 goes from the groin and the inner thigh. And then for the last one, I'm going to have her flip on her stomach. And this is going to be S1. So S1 goes from the butt to the thigh. And again, I'm still going to have her eyes closed, even though she's flipping around. Okay.
Test 4 are myotomes, which are related to her nerves. So her nerve roots connected to her muscles. So that would indicate any impingement or impairment connected to her muscle function. So I'm going to start with her L3, which is the extension. So I'm going to do a muscle test for her. I'm going to have her extend her knee out just slightly. I'm going to stabilize just above her knee. And I'm going to push down for 10 seconds. So ready? Go ahead. 1, 2, 3, 4, 5, 10. Good. And then I'm going to test her L5, which is toe extension. So I'm going to stabilize just below her tarsal head, like so. And I'm going to have her bring her toe up. Resist my push. Go. 1, 2, 6, 7, 8, 9, 10. Good. And then finally, I'm going to test her S2 nerve root, and that's her knee flexion. So I'm going to stabilize just above her knee, like so. Put her up in flexion slightly, and I'm going to have her resist my push down. Ready? Go. 2, 3, 4, 6, 7, 8, 9, 10. Good.
so now we're gonna move on to special tests. The first special test is the slump test, and this is for disc pathologies. So this one involves a couple steps. So first I'm gonna have my patient sitting like so on the edge of the table. And first I'm gonna instruct her to slump her shoulders over, like so, good. And I'm gonna apply pressure to the back of her head, like ever so slightly. And ask her if she's experiencing any pain down the back of her leg.
No.
I'm gonna do the same thing, but I'm gonna ask her to bring her chin to her chest. Still having her shoulders slumped, and I'm gonna do it again. Experiencing anything?
No.
Okay. And again, we're gonna have her shoulders slumped, chin to the chest, and we're gonna have her extend her knee. So like that, good. And I'm gonna apply slight pressure. Any pain?
Yes.
Okay, so she said yes, and is that down the back of your leg?
Yes.
Okay. So go ahead and bring your ankle up. And then we're gonna do it the same thing again with her shoulders slumped, chin to her chest, and knee straight. Do you have any pain?
Yes.
Okay, so she said yes, and this indicates sciatic nerve pain. And to alleviate the pain and or kind of figure out when it started, which was when her knee flexed, we can bring her knee back to normal. And again, put your chin to your chest and shoulders slumped. Do you have any pain there?
No.
So we kind of figure out that the pain happens once her knee is flexed. And again, the positive is, like Jenna had, was the pain down the back of the leg, which was associated with the sciatic. The next special test is the femoral nerve test, and the femoral nerve runs from L2 to L4. So for this, I'm going to have my patient in the sideline position like so. And for the test, I'm going to ask her to bring her chin to her chest, so to have her head flexed like so. And then I'm going to grab her ankle at the bottom like this, and I'm going to brace with my other hand against her PSIS. And I'm going to flex her knee and bring her hip back into flexion like so. I'm going to ask her, are you experiencing any pain?
No.
Okay, so she said no. I'm going to bring her back a little bit more, making sure you push against the PSIS. Are you experiencing any pain?
A little bit.
Okay, and she reports a little bit, and it's down the front of your thigh?
Yes.
Okay. And a positive with this is pain either radiating or paresthesia right down the front of her thigh, which is associated with the femoral nerve. The test we're going to perform is the single leg stance and or the stork test. This is testing for spondy conditions. So I'm going to have my patient standing like so. I'm going to instruct her to lift one leg up and cross her arms in front of her chest. And I'm going to place my hand on the back of her lumbar region like so. And then I'm going to have her lean back. I'm going to slowly pull her back. I'm going to say, are you experiencing any pain down where my hand is?
Yeah.
Yeah, so that would be a positive, and a positive again is pain down in the lumbar S1 region. And then you can repeat on the other side.
Okay, so the next special test we're going to do is the Ginson's test. So this tests for SI dysfunction. So a positive would be if she has any pain in her SI, which is right about here. So I'm going to have her slide off the edge of the table just slightly, and I'm going to have her leg, one leg down. Good. And I'm going to have her pull this leg up. I'm going to push down on both. Ready? Right. Okay, do you have any pain in your lower back?
Yeah.
Yeah? Okay. So that would indicate any SI dysfunction. And then we can do the same to the other side. Just like so. Any pain?
No.
Okay. So that would indicate that she has a problem with her SI going with her left leg down and her right leg. Okay, so the next special test we're going to do is the spring test. So what we're looking for here is any excess or no joint play at all, posterior, anterior joint play. And then if there is or isn't, that would be an indication that there is a spondy problem or there may be a ligamentous sprain. So I'm going to feel for her spinous process, which is a bony protuberance sticking in her back. I feel one right here, so I'm going to test this one right there. So what I'm going to do is I'm going to use my thenar eminence and I'm going to push down on her spinous process. And I'm looking for her, for a little spring back when I push down. So I feel right there, I'm going to push down. And she does have a spring back, like a little spring when I push down. So that would indicate that there is no issues with her vertebra or any indication of a spiny or a spondy problem or ligamentous sprain. Okay, so the last special test we're going to do is the Hoover test. So what the Hoover test is for is to see if the patient is faking it or to test for any malingering. So what I'm going to do is I'm going to hold both of her calcaneus like so up in the air, and I'm going to have her lift one of her legs. So I'm going to have her lift this leg. Go ahead. Good. And so that would indicate that she's not faking it. A positive test would be if she claims that she can't lift her leg up, and I don't feel any weight in my opposite hand, because the natural reflex is for her, go ahead, lift your leg up, is to push down with her opposite leg. So if she's saying that she can't lift her leg up and I don't feel that weight in her opposite leg, that would indicate that there is malingering or faking going on.